Ready?
I'm ready to rumble.
Marvelous. Off you go.
Thank you very much for this kind introduction and the opportunity to be here today with you to think about the future of healthcare and the different challenges we have to address and the opportunity here and facing these new opportunities already now. So a few days ago, my son told me, "Mommy, I finally know what I want to become. And I'm well equipped already." And he showed me his equipment. And at this point, I thought, of course, about the future of medicine even more in detail. What does it mean for him as a physician if he really stays with this choice? What does it mean in the context of the burdens he has to carry and the challenges? And additionally, what does it mean for all the other stakeholders who want to improve the patient's outcome at the end? And this is still our major objectives, to put the patient in the center. So I'm happy to think with you about all these different topics, and I'm aware that the challenges have not changed directly after all this initiative which have popped up during the last years. So the increasing costs are still a major topic with expectation of around 8.7 trillion euro till 2020 as global spendings. And the chronic diseases are on the rise, with causing almost half of the deaths in the area of cardiovascular, diabetes, cancer, or depression. So it is, of course, clear that a physician needs tools, technologies to facilitate his daily job, and that the patient, of course, needs trustable and secure ways to engage with these professions and to stay in the loop. Big data is already addressed by this community, and it is the crucial first step to enable all the intelligent solutions which will drive the future discussions. So we have to do our homework, we have to set the base, and digitization is, of course, one of the major elements which can help us here. Focusing around the patient will still be the crucial element. Embedding the patient in the center will be the major tool. And digitization in healthcare in the past has lagging behind. But now we are on the right way to improve this by increasing the maturity of our infrastructure, by changing the incentivization in healthcare, and by moving from the volume to the value in many different pilots and initiatives. It's now time to move to the next level, to reach the next state, and to get the scale to drive this really towards the patient and improve the outcomes for the patient at the end. So we as a community, as IMI, are well positioned to make this scalable, to make this really approach which is forward thinking. There's a lot of different technology applications on the rise, which allows us to integrate all these complex data sources, from genomics data to clinical data, from, of course, unstructured data sets, and then get a holistic overview about the patient at the end. And these tools can really help us to transit from the classical or the traditional care models to these integrated care models, to the value-based care models. We need a continuous engagement with the patient, long-term, forward-looking. We do not need only curative approaches which interact with the patients from time to time. Prevention is one of the major issues here, and we not only talk about primary prevention, we also talk about prevention in the follow-up, secondary prevention at the end. Here, digital technologies can help a lot and can facilitate many different approaches in the life of these professions very much. So what we have done in the past successfully, and also which was done here with the big data strategies within IMI, is really to cluster around these diverse data sets in healthcare, to really use new technologies like natural language processing to learn out of this unstructured data. And access to this data and to a bigger amount of this data in a high-quality fashion is the crucial element to apply all these new technologies like machine learning, artificial intelligence, or blockchain to it in the future. So really the base is set, and now we are able to transit into the new era of intelligence, I would say. And we can use these new technologies not only for creating new use cases like predicting the mortality rate of patients or predicting the readmission rate of patients. We can use this also already at the base, for example, for NLP. It's especially a challenging topic if you use machine learning in the entity recognition area of the clinical facts, to really harmonize the data, make it understandable, because a stakeholder is, of course, using another terminology than another one. Yeah? Interoperability also on the semantic layer. This is a crucial aspect we have to still work on, and we have to scale up in the future. SAP can here bring to the table, of course, a lot of technologies which can facilitate this, and a lot of experience we have brought up during the last decades working with healthcare experts in the different domains. So the most people are aware about SAP from the ERP solutions and the old-fashioned topics which are connected to SAP as only ERP vendor. But we have, of course, a lot of innovation portfolio in the context of healthcare relevant assets. So we have set up a lot of new platforms and technologies around machine learning, around artificial intelligence, and the integration of diverse data sets within healthcare. Talking about omics data, talking about imaging data, and this is not happening with one single player in this area alone. We need strong collaborations here, strong partnerships. There is a lot of expertise here in the audience, also in the case of imaging, and a lot of expertise in the case of genomics, of course. So an ecosystem play, like it is here driven by IMI, this is really the benefit. This will really make scalable use cases happen, which we have never seen before. So yes, let's transit to the next era of intelligence. Let's use these new technologies. Let's play, let's test how they can really facilitate for pilots, but also for scalable projects, the life of the patients and the physicians, and how we can transit it into the community. Blockchain, often mentioned, one way of secure communication for the data sets which are really sensitive and which need to be tracked, and the access to these data sets need to be monitored. It is really crucial to use these technologies to drive the next generation of trust, and when we here come together with these different stakeholder opinions, trust should be the major element which brings us together. The Internet of Things and the sensor data which allow us to really create huge amount of data machine learning algorithms can learn from. You can compare it a little bit with your body and your brain. The sensing in your body is then resulting in an information, in a mining of your brain for the right decision and the right outcome at the end. So IoT technologies will help you with the different sensors to teach machine learning algorithms and then get an input out of it which can help physicians with the right decision, or can help to identify the right leads in the drug development process, or can help to stratify patients with the right risk group at the end. This is not disease specific, it's really agnostic. So what we do in risk stratification for diabetes, we can also do in risk stratification for cardiovascular diseases. Of course, the domain expertise to set up these stratification algorithms. This is, of course, one major aspect experts like you and the different academies bring to the field. So it's somehow all interconnected with each other, and the mobile devices on their own are more and more a medical device. And here also collaboration and cross-sector collaboration is a major driver. You do not want to have a patient assessing an app and then has to enter all the data for another app he has on his mobile phone. So we need a seamless interoperability and connection of these devices. And this, of course, collaboration approaches can make happen and are already happen. For example, we have a strong partnership with Apple there to make it happen that not everything which is entered in the Apple Health Kit has to be repeated for the other solution we are building in the context of prevention or adherence. We have a strong partnership with Elitic or other cloud aggregators to facilitate the way of medical device integrations within such platform topics. Personally, I think when we have a look at the priorities here which C-level executives in healthcare have defined, our objectives have not changed yet, and I think they will not change that much. We are still aiming for improving outcomes of patients, but we can speed up to get there. We can try to set up the right success factors to enable us to embed these new technologies there, for example, to make data more accessible in a secure and trusted way, to train these new technologies at the end, but we will center around the needs of the patient also in the future. So I think our priorities should not change that much. We have already the right topics at our agenda, but we need to scale them, we need to bring them in a reliable and proof-checked way into our community and make them really used in a clinical context in a daily care process. Let's deep dive into some examples how value can be unfolded with digitalization in the value chain. And of course, operational efficiency is also one of the major topics when we think about cutting costs in healthcare. Yeah? So whatever stakeholders are sitting here, they also aim for operational efficiency for their own enterprise and for their own institution. Because at the end, if you save there, you can of course offer more resources on the other side. And if you empower your workforce and give their tools to reduce the redundancies which they have to undergo steadily, then they maybe have more time for communication with the patient at the end. So with Mercy, for example, and the chain of more than 40 hospitals beyond, we managed to really reduce costs in optimizing peri-operative services within this network. Yeah? And to really make transparent what is happening with the assets, with the data, and with the different investments you are doing in this area. So transparency is one of the major objectives and big opportunities we have. Just by seeing what the data is offering us, we can draw a lot of conclusions out of it. And additionally then use these new technologies to predict, like for example, how the future will look like. Another example is the Seoul National University Hospital and the antibiotic stewardship program they have undergone, where they have seen also with real-time analysis of the healthcare data they have brought together about the patient and the holistic picture of the patient, where they have seen how they can reduce the usage of antibiotics in a really significant manner and reduce the time which is spent for bringing together all this data in a very impressive way. Patient engagement and prevention, one of the major aspects also in our society. Roche is one example where we really can see in a lighthouse case how this can be connected to development of also new business models. They have set up a diabetes prevention program based on SAP technology, and they have done this to really engage with pre-diabetes patients, to guide them together with the physicians who are, of course, in the lead there, to really apply the different programs there for prevention, to reduce their weight, to follow the instruction, and to minimize the risk to develop diabetes at the end. And it was so successful that this is also now reimbursed from the insurances at the end as a service kit. So you really need to look for these kind of additional new services beyond the original models which exist, and new services you can offer towards the patient. CancerLink. Let's go to CancerLink, one of the learning health systems I want to introduce you, if you are not already aware of it. So this is a really impressive case where with the American Society of Clinical Oncology, millions of patient data sets were drawn together by different institutions for one common goal, to share the knowledge about these patients, to learn from each other, to build a learning health system. And then, of course, to use this on top for benchmarking clinical quality measures, to establish the right standards of clinical quality, to find patients like mine as a physician and compare their procedures to what I want to apply to them, to really decide what is the best treatment for my group of patients and learn from my peers. And this is something we should aim for also on the European level, a scalable learning health system as a first step, and then on top use all the different technologies to build these intelligent solutions at the end. The medical care all-round solution is something which the Charité has established. It is an impressive program around transplant patients, which have to deal with a lot of medications, and adherence is one of their major problems. So what we need to do here is not only to prevent patients and to care for them in an efficient way, we also need to follow up what they are doing. We need to guide them after such complex treatments like an organ transplantation, and we need to help them whenever a problem occurs. And this was here done, driven by the Charité and a diverse network of partners, which really helped these kidney transplant patients to be monitored in the context of different parameters of risks to lose this organ and to be adherent to the medication at the end. And this is another successful example how engagement platforms or technology behind the engagement platforms can be used with sensor data embedding and all the different modules to really offer new services beyond the typical care models to the patients. We already have several initiatives in Europe which are promising that we are moving into the right direction. IMI has already mentioned the big data initiatives they are driving. The Federal Ministry of Education and Research in Germany has also invested 150 million over the next 4 years to grow a network of collaboration partners within Germany. They focus on setting up an infrastructure. Think about cross-institutional tumor boards in cases where one physician cannot find the answer anymore. Think about use cases like infection controlling and about use cases like cardiology. There is a lot of different opportunities are stepping up at the moment, and I'm looking forward to see the results out of these initiatives and the different solutions we can bring here to the field as an industry partner in the case of technology. So we are engaged in 2 out of these 4 consortia really to help with technology to facilitate and scale up there and to bring, as I said, this nationwide network to the next level of maturity. Last but not least, I want to present you also one example about surgery, which is the new operating theater of the future we have together with Siemens, also plan to set up in collaboration with the University Hospital in Heidelberg, where here really also medical device companies, pharma companies, and of course also IT companies join forces to establish the new surgical theater of the future, which then allows to embed diverse applications on our own business platform, which are useful for the surgeon at the end, which amplifies the value in the short time during the procedure, and which allows us to have a stronger quality control of these processes in the operating theater in the future. So there are a lot of really exciting use cases at the moment all around us, and I'm looking forward to see the new technology drive this to the next level. And I think together with IMI and the cross-sector collaboration we are able to do here, this will be scalable and really exciting with the several partners to step into the next direction and of projects here. So whenever there is an opportunity you think of, please reach out to us and let's go into deep discussions there, because I think we are best positioned here within such a family to drive the next level of innovation. So let me close with this quote. I think we all know that change is really fast, but it will never be that slow again. So let us really now join forces for the next level of intelligence and embed the new technology and digitalization strategies here also within IMI. Thank you.
Thank you very much indeed, Annette. Now, you talked about trust and transparency being a very important field that that agenda should be taken forward.
So with this cross-sector collaborations like we are here coming together today, of course we see already a lot of change, yeah? The different parties moving together, joining forces, meeting, going in cross-collaborative projects. This is a new direction we're highly appreciating. And in our design thinking approaches with the solutions, we bring together patients and the different stakeholders from the very beginning in a very open atmosphere to build these new solutions and platforms, and this is working perfectly. From the beginning, concrete work together in this multi-stakeholder atmosphere and work together. Of course, at the end, you have somehow to divide which company is doing which part of the puzzle piece and come together with the different skills and talents, but we are all really in a complementary fashion able to support each other here with the domain expertise we can bring to the table. And therefore, SAP is really, really excited about the progress into this direction. As one of the first European IT companies, we have additionally set up an ethical steering committee with different external experts who are giving feedback into the different topics like artificial intelligence and security, data protection, and so on. So I think we all have more than a few reasons to trust each other and the technology will help us also with the secure different solutions to have a look at the data and the accessibility of the data, by whom it is accessed when, so that there is no reason to not have trust.
Any questions from the audience? Question here. And tell us who you are.
Yes.
I hope I've got this turned on. Never trust a broadcaster with a microphone.
No?
Yes.
Yes. Okay, good morning. My name is Alessia Gramuglia from the European Federation of Nurses Associations. Thank you very much for your presentation, for the interesting cases you presented, and also for stressing the importance of cross-collaboration. In this sense, I would like, more than a question, I would like also to make a remark, because we believe in the FN we represent 36 national nursing associations and 3 million nurses in the European Union. It's important indeed to involve all the stakeholders in the process, and we believe that to have a real and positive transformation in the digitalization of the health and social care sector is crucial to involve, again, all the stakeholders, including the healthcare professionals that work frontline. Therefore, we believe that a concrete engagement in the co-design and the co-creation of digital health solutions will be really achieving a positive outcome if you involve these end users from the beginning. Therefore, I also invite you to involve 3 million nurses in your projects to achieve a successful outcome.
And also that speaks to another part of the IMI mission, which is to make sure that these developments are rapidly adopted and diffused. And if you haven't got the engagement of healthcare professionals, some of those things do not get taken up.
Yeah, of course there are a lot of barriers existing, and the education of the different professions is one of our major tasks, and working with patient advocacy group is one of our major tasks there to really get into closer and reliable discussions and campaigns which are educating how digitalization can add a value to society and how it can really facilitate the daily life of a physician, because the best solution, if it costs more time on the physician side, will not be applied. And although I mentioned often the name physician, this is of course meant for the whole care team. Yeah? And we see, I have flown in yesterday here to Brussels with an article in the newspaper demonstrating that there is a huge emergency situation in the children's hospitals with a resource situation which is really escalating. And this is especially into the direction of the whole care teams, where they have to decline the number of beds because the resources are limited. And ambulances have to circulate around the hospitals with emergency case patients without finding a slot for them. So really, really empowering the workforce there is one of the most crucial elements to drive down this pressure on the shoulders of these care teams.
And it also speaks, of course, to making sure what the needs are, rather than develop solutions for problems that don't really exist. Go to what the needs are. We had a question back there. Hello, sir. Who are you?
Yeah, okay. Chris Moder, Soft Systems. We are guys from Big Data. I have a question. Obviously, SAP is a great company. You deliver great technology. You mentioned also Apple. But both companies are premium brands. Did you ever consider supporting open software project that will actually do similar thing for hospitals or for countries that money is really does count?
You're right. The projects I mentioned here were, of course, describing collaboration topics with big players in the field. But SAP has also set up our own startup program and entrepreneurship programs where we really work together with innovators in the startup area and different smaller and medium-sized companies, which we really drive innovation with in different countries globally. So yes, maybe there are a lot of more examples you could mention also as a partners within our ecosystem, adapting technologies and building new technologies on top of it. So there's a lot of potential also to be a partner within such an ecosystem as a smaller or medium-sized company and drive innovation in whatever country at the end, especially in countries which the big players might not be present in this space. We are relying on the partners and the domain expertise of the small and medium companies around us. Yeah.
And I think your question was really also about the cost, wasn't it? So that you're making lower cost solutions available.
Okay. So of course, the strategy to make sustainable solutions also available for the specific, for the reimbursement processes which are really affordable by the patients and the society. There we are of course working together in funded project with the ministries to set up really business model which can be sustained at the end. So prescription models for medical solutions at the end, which should then of course be sustainable. But step by step, you have to prove the endpoints first of these solutions and then go into selective negotiations with the insurances to really make sure that these solutions are available to every patient at the end and not just to the higher end society. Yeah.
Okay, so you can see some of the comments coming through from Slido. Sir, who are you?
Can I go ahead? Yes.
Yeah.
My name is Dimitri Georgiev. I'm from Bulgaria. My
Hi.
question repeats partially the two questions before that. We have seen very nice examples, which are mainly in Germany, which is understandable more or less. Do you have any plans to advance to other countries in Europe in a more sustainable and fast pace? Because I am confident that if you go to countries which are in the southern part of Europe, you will find another challenges, but also other data, which might be very interesting for SAP.
So of course we are a global company and we are engaged in different projects within the European region, and I think personally we should drive education also in more and more countries and collaborate also in more and more regions. We have also collaborations with Cerner, for example, which are strongly also in the southern part of Europe available. So what we really see is here that we cannot educate and collaborate enough. So we are engaged in EIT Health also and in other collaborative ecosystems to drive this to the next level. But if you have a precise idea for a specific region or something like this, let's go into discussion and see how we can also there with a local strategy apply SAP technology to this environment and facilitate at the end the majority of the infrastructure in this region.
Thank you very much. Now, we've got some questions there, but actually, so the top question there, how are the suggestions from interim evaluation on improving transparency and governance? I happen to know that that's going to come up later. So if you don't mind, we're going to address that later. Meanwhile, Annette, can I say thank you very much for your presentation.
Thank you.